severe acute respiratory syndrome coronavirus 2 associated cytokine storm. One bad thing regarding the disease process is we are still under investigation of cytokine storm pathogenesis of coronavirus. But as we all know, the disease process of the coronavirus have a wide spectrum. One patient can have very mild infection. Next patient can have multi-organ failure and can even die. That means the disease spectrum can be mild to even death. Virus is the same organism. Same organism came to mild patient and same organism came to dead patient. That means the injurious agent came to the patient is same. Why this patient died? Why this patient recovered even without symptom as well? We have a doubt. Why this patient dead? Why this patient recovered? What they thought is initially, the death is mainly due to not the coronavirus. Not due to coronavirus. Because of that viral infection, you get the cytokine storm. With that cytokine storm, you are develop multiple organ dysfunction. So next question is whether that cytokine storm is driver of your disease process, or this is due to viral activation, whether it is came as secondary process. To identify that, you should have clear knowledge about the cytokine storm pathogenesis. But unfortunately, they are still under investigation. If you found that clearly, the cytokine storm is the driver of the COVID-19 disease process, you can destroy or you can suppress the cytokine level at the level of initial stage and you can survive your patient. Or if it is due to secondary process, patient bad cytokine storm come as a secondary process, then you have to maintain those cytokine, not the cytokine level, patient viability. You have to target treatment against the virus, not the cytokine storm. If it is a driver, you can target the treatment against the driver. If it is cytokine storm is a secondary process, you have to target the virus. Then subsequently cytokine storm not will come. Okay, we'll see what is the pathogenesis of cytokine storm in coronavirus. I already told it is not 100% clear up to now. But they found to have, there are spectrum of disease with mild, patient with pneumonia, patient with cytokine storm, and ultimately went to multi-organ dysfunction. Once your coronavirus enter into your lung, they found to have large amount of CD4 cell and CD8 cells in your circulation. Large amount of CD4 cell and CD8 cells. What is the meaning of CD? CD means cluster of differentiation. The cluster of differentiation 4 cells and 8 cells are there. 4 cells mean T helper cells, macrophage. Those cells containing CD4. CD8 mainly containing cytotoxic T lymphocyte. So what they found is increased amount of T macrophage, which was a part of innate immune system as we already discussed in previous lecture, and T lymphocyte and T helper cells and cytotoxic T cells, which was the part of acquired immune system. So when they investigating the cytokine process and the further cells, they have found hemophagocytic macrophage was there. That means, as I told in my previous lecture, your macrophage activated with coronavirus Now they go into and engulf whatever the thing they met. One of the thing they met is red cells, WBC, viruses and those things. They can engulf viruses, they can engulf red cells, they can engulf white blood cells. Because of that red blood engulfment, patient can develop hemophagocytic macrophage in their blood. So it was a marker of immune system activation. Truly speaking, innate immune activation. With that, patient can develop cytopenia as well, as I told already. In addition to that, they have found out large amount of cytokine, mainly interleukin, tumor necrosis factor, interferon gamma, and vascular endothelial growth factors. Those are increased. Then they thought how this cytokine storm occur. As I discussed previously, whether this is due to hyperimmune activation, increase the triggering or increase sensing, or reducing resolving process due to itself inhibition of T lymphocyte and T helper cells, or due to ongoing inflammation, whether it is due to hyperimmune activation, reducing resolving process, or ongoing inflammation. But still they do not found exact mechanism for hyperimmune system activation in COVID-19 patient. After that, with the high interleukin 6 level, they have found out short survival. Not only COVID-19, many patients with high interleukin 6 level found to have high mortality. There are two kinds of cytokines. One is called pro-inflammatory, other one anti-inflammatory. There should be balance in between pro-inflammatory and anti-inflammatory cytokines. Interleukin 6 is major component of pro-inflammatory cytokine, which induce inflammation further and further, which can lead to distant organ damage and multi-organ failure and finally death. In patient with high interleukin 6 and COVID-19 positive have short survival, that means increased mortality. In addition to that, after that, they found to have their serum patient with COVID-19 found to have high C-reactive protein. C-reactive protein produced from liver and low albumin, D-dimer, and those patients develop AKI and ascites as well. As I already told, for the cytokine storm, 3 cell lines are mainly involved. 2 cell lines with plasma protein. This is plasma protein, including complement, C-reactive protein, and ferritin. Those are the major proteins involved in the cytokine storm. In addition to that, chemokine involved and cytokine involved in cytokine storm. So they have found cytokine in their blood and chemokine in their blood, part of here also containing chemokine. In addition to that, in their plasma they have found out complement and C-reactive protein and ferritin as well. Because of that, they think in that patient body, in a patient with COVID-19, in her blood, there is a material, there are a lot of material which are responsible for cytokine storm. That means the probability of having cytokine storm is too much high. The last thing, whether that cytokine storm is driver or secondary thing, as I already discussed it previously. For that, to identification of whether it is driver or secondary thing, it is really important. If it is driver, you can easily treat with, not easily, you can treat with immunosuppression. If it is secondary thing, you can't do that, because if you suppress the cytokine storm, the viral load will increase, the disease process will be increased. They did few research to identify whether it is primarily due to driver effect or secondary cytokine effect lead to cytokine storm. First one, they did the nasopharyngeal viral load and the disease severity and cytokine status. In patient with moderate disease, and high cytokine, they have found out those patients have low viral load. Moderate disease with high cytokine and low viral load. But when patient come into severe disease, when patient with severe disease and high amount of cytokine, the viral load not low as compared with mild moderate disease. That means when your cytokine level goes up, it will not properly help in destroying the viruses. That means that cytokine come and attack on their own cells, and it also can go into down, it also will down regulate. Because of that, disease process also will remaining, and cytokine, because of cytokine action, you can develop multi-organ failure. According to this one, you can think it is not come as a primary driving effect, it comes as secondary thing. That means you have to treat disease. Once the disease is totally clear or under control, you can try with immunomodulator drugs or immunosuppressive drugs. Number 2, what they did is they started dexamethasone in patient with COVID-19. In patient with mild disease, they have found out increased mortality. That means in the mild disease process or in the earlier disease process, you should have cytokine in order to suppress the disease process. It was proven with inhalation beta interferon. Beta interferon is antiviral agent. Once they inhale those things in patient with mild disease, it improves the survival and reduces the mortality. But when coming to the severe disease, your cytokine storm is now large amount of cytokine produced. Because of that, in severe disease patient, if you are going to give dexamethasone or if you are going to give suppress immune system little bit, they found to have improved the mortality. That means reduces the mortality. How they found the severe disease? In patient with COVID-19 and high CRP, they taken as severe disease, and patient who need oxygen as supplementary oxygen, they taken as severe disease. So that means the cytokine production is must need for prevention of disease, but excessive amount of cytokine can cause secondary organ damage. That means it comes as a secondary thing. In addition to that, in patient with inborn error of type 1 interferon production or autoantibody to type 1 interferon, which is necessary for antiviral action, they found to have high disease severity in those patients. That means for the initial stage, you should have certain amount of cytokine in order to come from the disease status. And the last one, they give another kind of theory. Called molecular mimicry. It was little bit proven with the drugs as well. Molecular mimicry means when you get the COVID-19 infection, you try to produce certain antibodies against the viruses. But those antibodies goes and neutralize viruses and destroys those things. But there are some cytokines which produce in the disease process, can go at your own body due to molecular similarity. That molecule, carbohydrate molecule usually, that carbohydrate molecules are very similar in viruses and those things and body tissue as well. Because of that, inflammatory mediators which produce in the coronavirus infection can go and attack various body systems, including heart, kidney, brain, and those things. Because of that, patient can develop post-inflammation multi-system inflammatory syndrome. Post-inflammation multi-system inflammatory syndrome. When those syndrome develop, usually you develop enough amount of antibodies against the coronavirus. Enough amount of antibody develop. Because of that, you can easily treat with immunosuppression in order to prevent post-inflammatory multi-system inflammatory syndrome. You can use IVIG, intravenous immunoglobulin, glucocorticoid, anti-leukotriene 1 and leukotriene receptor 6 blockers you can use. You can 1 and 6 also you can block. So we'll see how are you going to manage in patient with cytokine storm. Not only here, not only patient with coronavirus, all kind of patients. It is very simple. Once you get patient with coronavirus, don't be panic. Use your tools. It's not a tool. Tools. Okay. We'll see how I'm going to manage. If your patient develops cytokine storms, number 1, what you should do is supportive care for critical programs. Supportive care for critical program. That means if your patient develop respiratory distress or ARDS, you have to ventilate. If your patient develop AKI, you may have to dialysis. Or if your patient develop hypotension, you may have to start iron drop. Second thing is try to eliminate the triggers. Try to eliminate triggers. If it is a bacterial infection, you have to start antibiotic. And if it is a viral infection, initially you can try with antiviral agent and immune enhancement agent. But later on with high immunity will be bad in certain kind of patients. The patient who develop cytokine storms. Third thing is you can start targeted immune modulation. Targeted immune modulation. You can block those cytokines separately. Tumor necrosis factor, interferon, interleukin. You can block those cytokines separately with various kind of drugs. So you can have target immune modulation or non-specific immune suppression. Non-specific immune suppression. Why you need non-specific immune suppression? To stop the collateral damage. To stop the collateral damage, you can use non-specific immune suppression. The secondary thing means the collateral damage. Or the target immunomodulation. Now they are too much worried about target immunomodulation. For the coronavirus itself, they are developed more than 100 immune modulators and targeted cytokine blocking drugs in order to treat the cytokine storm in COVID-19 patient. We can block those drugs directly. In addition to that, we can block the receptors those drugs act. Those are the rough idea about the cytokine storm in the